Hey, what's going on there? Dr. Jason McCammon with Elite Health, naturopathic and functional medicine here. I want to talk to you today about some neuropsychiatric issues, especially that occur in little ones. They can occur in any of us, but especially the little ones. It is really hard to watch, a 2, 3, 4, 5-year-old with just these tremendous health problems. It just tugs at your heart, man. So it's something that I've researched and actually have several patients that we're taking care of that are responding outstanding to what we're doing here. And so let's just start to talk about it a little bit. We're going to use some medical terminology, even though we don't diagnose here. These are things that, conventional provider may suspect they have. And again, you can Google this and look up the symptoms. So PANS, I don't know if you heard that, PANS, Pediatric Acute-onset Neuropsychiatric Syndrome, okay? Excuse me. Is going to be caused by something, typically an infection. Obviously, there's many parts and pieces to this, but that's a more broader term. And so we want to really figure out, again, holistically, what's going on with this child, okay? And the conventional tests are, again, blood-based, typically. And we're not going to be able to find really the root cause floating in the blood, guys. It's pretty rare. If you find a lot of bacteria in the blood, you're going to be, really hurting, right? That's called sepsis or potential sepsis there. So my point is, if we only look at blood, but yet it's rare that we see infection in the blood, unless again we had dealing with some really near fatal conditions, then we're going to be underdiagnosing or missing the diagnosis. Okay, so we've got to look beyond that. So we do urine saliva studies here. We also do quantum biofeedback, which is unbelievable, most advanced platform on the planet for figuring out what could be going on, the underlying root cause. Okay. So anyway, we've had several little ones in here. I think 4, 5, 6-year-old, kind of in that range over the last couple of years, and respond great to the program. But what I'm pointing out is there's another condition there that kind of like a sub-condition of that is called PANDAS, right? So we've got pediatric autoimmune neuropsychiatric disorders associated with strep infection, right? So PANS and PANDAS are kind of related, may not be, may be, right? The point is, we don't really want to get so caught up on the label. However, if your child is dealing with this, you've been diagnosed with this, or you suspect these type of symptoms, what are the symptoms? Getting extremely irritated, angry, and violent, okay? Obviously super moody, having trouble focusing, kind of like restless all the time. We've got obviously complaints of pain sometimes in the belly, throughout the body. It's very defined as well. As they get a little bit older, of course, we have little ones, right? They're supposed to challenge us, but if they're extremely defined and just won't do anything that you ask them to do, even the simplest little task, you may be dealing with somebody, a little one that has PANS or PANDAS there. So again, I encourage you to just, if your child is dealing with that, again, is your provider schooled in this? Are they educated in these conditions? And not so much just to diagnose it. That's just one little piece of it, right, guys? You have to now create a plan, work with a provider, create a plan to address the underlying causal factors, okay? So these little ones that we've had in here in the clinic the last few years, sure enough, they do show they have strep infections in their brain, which is pretty scary for, again, a little one, you can imagine. And conventionally, they almost will never find that officially. So they have to diagnose them on just symptoms alone. We have, again, we have biofeedback technology in the clinic here that can actually help us determine if strep is an issue in the brain. Okay, so it's really a huge breakthrough in medicine to be able to say, yeah, this is actually, we can confirm and validate what this family and this child is going through, and then we can create a plan. And there's very specific medicines that we can order and prescribe to make sure we handle that. So that's what we do here. So in fact, these little ones have done unbelievable on the program because, again, we have identified what is going on. Now, it is impossible, nearly impossible, unless you have a leaky blood-brain barrier, to get an antibiotic into the brain. So here's the deal. Conventional medicine has acknowledged that there's likely a strep in the brain. It could be other areas of the body, but especially in the brain, causing neuroinflammation. And what do they put them on? Antibiotics. Okay, antibiotics, the vast majority, do not cross the blood-brain barrier. So let me get this straight. We know we have a strep infection in the brain, or likely. We go on conventional antibiotics that don't cross the blood-brain barrier. How are we actually going to get that colony to reduce enough to reduce their inflammation? Doesn't make any sense. And yes, we've had families in here that the kids have been on those meds and almost no improvement. In fact, some get worse. Why? Because instead of helping treat the infection, it's killing the gut, right? And the more the gut microbes get destroyed, the more dysbiotic we get in the gut. And you know we have a gut-brain connection. So guess what? Here comes more neuroinflammation through with pathways like lipopolysaccharide, like LPS and things like that, that are going to be leaked into our blood and inflame our brain. Okay, so one of our secret weapons here, homeopathic medicine specifically designed for this. Not just any homeopathics. You're not going to find them at the health food store. They're doctor dispensed only, but they're going to be very effective. And why is a homeopathic going to do a much better job than an antibiotic? That's because a homeopathic is energy medicine. It literally is a frequency, okay, very specific, special frequency that of just literally energy that's vibrating. And that person takes this medicine, and you can imagine that's just energy. Energy travels instantaneously to our body, you know, right now. Like every cell in the body gets this message right now. And so it doesn't need to be metabolized. It doesn't need to cross the blood-brain barrier. It's in his brain like now. Okay, that's the idea behind trying to, sorry about that. That's the idea behind trying to make sure we address the root cause. We've got to address the root cause, or any illness, especially these little ones, are not going to get better. Okay, so we address that, but guess what? We've got more work to do. Most little ones with PANS or PANDAS and these other neuropsychiatric conditions, or neuroinflammation in general, have a really bad gut microbiome. And not just the microbiome, but the actual lining of the gut. The mucosa is all destroyed, and they have basically classic leaky gut, right? We're leaking fecal matter, undigested foods, and we usually have some parasites. We almost always see parasites with this condition, and that's leaking into the blood. So that's where the autoimmune part of PANDAS comes in there, because now we have our body freaking out because it's got all this antigens, which are foreign proteins, running around the body, and they shouldn't be. So you get this wholesale freak out of the body, and then now we get excessive histamine. Histamine can create also mood disorders, can create brain fog for the child and learning development issues. And then from histamine, we get cytokines. Cytokines are supposed to be, part of that domino of our immune response. And then the cytokines are going to cause what? More inflammation, unfortunately, right? They're there for a reason to signal healing in the body, but when they run unabated constantly, the cytokines create more inflammation. And that's where the achiness comes from, and things that you deal with your child that may have this condition, okay? So we've got to heal the gut, really important. And again, the little ones that respond well in the program here, are we able to heal their gut? That's just key. You know, you've got to be able to do that. We also have to be able to get them on certain dietary food patterns that are really best for them. Okay, not always, but usually we see a link with food dye. We've got gluten, and I recommend cutting out all grains for these little ones here. But again, has to be with you and your provider. You've got to figure out what works for that family and that little one. But those are big. Oats and corn and wheat are pretty much out for any kind of condition like this. They got to go. But we're going to have to do counseling and coaching on what can they eat. So we have a whole program. We have a nutritionist here that's going to help families be able to say, okay, if we can't eat this, what can we eat? We're going to help you with that support. Okay, so anyway, little ones are doing amazing on this. And so we've seen a lot of success with it. And the conventional route is just not going to really get you anywhere, in my opinion. Very rarely going to end up with a good outcome from that. So just keep that in mind, okay? Hopefully this was helpful. A little education for you to kind of run with and look into some more. And God bless. Take care. We'll talk to you soon.